The cosmetic dentistry, it can range from replacing some darkened fillings with white fillings. Some people are unhappy with the silver fillings that they want them changed. That's on one end of the spectrum. Then you can get into bonding that can be done. The difference in bonding and laminates or veneers is that the veneers are kind of like a fake fingernail that your lab processes, and you put that on the tooth. It can change the shape or the color of the tooth. With bonding, you do it with a white filling material, and it's a one appointment process. And there's advantages and disadvantages to both. And then of course you go with crowns. Two main purposes of crowns are cosmetic, again, to change the color or shape. If someone has a tooth that's out of position, sometimes we can do a crown on it and make it look like it's in position. So we call it instant orthodontics. And the main functional reason for doing crowns is to strengthen the teeth. You do a filling on a tooth, that weakens the tooth somewhat. If it's a small filling, then the tooth's not weakened that much, and you don't need a crown on that tooth. A lot of people don't understand that once you have a filling in the tooth, you're more likely to have a problem with that tooth than if you never had a filling to start with. I think some people think, oh, I got a filling in the tooth, I don't have to worry about this anymore. So a tooth gets to be 40 or 50% filling, that's when I start thinking it's getting weak and we might need to consider a crown on it. If you have some teeth that are 40 to 50% filling and nothing's wrong with them, I don't have a problem leaving that alone. If and when something happens and you need a filling and I'm going to change that to 70% filling, then we might consider talking about a crown at that point. Or if you come in here and you've got some fillings that are already 80-90% of your tooth, that's just an accident waiting to happen. We need to talk about go ahead and doing something proactively on that. The other difference, crowns and fillings, the acids in the mouth that cause the problems, they eat into enamel, causing cavities. When you get fillings, they will corrode your fillings over a period of time. So then that goes back to educating the patient that you need even more attention to your hygiene, your flossing, your brushing than before you had the fillings, or else we're just going to be back in there changing these fillings out. Your crowns, the porcelain and metals that we use are not affected by the acids, so they don't corrode. It doesn't mean you can't get cavities around them, but it won't happen nearly as quickly as it will around fillings.